Ladies and gentlemen, dear colleagues, like-minded friends, health is on fundamental value for humanity. Determinants of health, including properly staffed health systems, are a big issue for Europe and the globe. Most nations committed themselves to the universal health coverage, patient-centered approach, community-based treatment, leaving no one behind. Achievements of all these noble goals is impossible without appropriate healthcare workforce. Work for the elimination of labor shortages, for longevity of population are sides of the same coin, and I am proud to be between those who, by signing a manifesto for a European Health Union in 2020, were calling for stronger human capital and for more Europe in health. Today we are opening a new cycle of debates and discussions in the frame of 3 years project working together to address health workforce mobility in Europe. We are starting our debates on the basis of broad understanding already accumulated by research community, local, national and international institutions. I would like to highlight some ideas on health workforce mobility in Europe that were developed before the project. First, while the magnitude and net directions of health professionals' migration flows change over time, there is an increasing trend of movements from lower income countries in Southern and Eastern Europe to higher income countries in Northern and Western Europe. Second, the main underlying causes of health professional migration and mobility are of socio-demographic, financial, organizational, managerial, and political nature. The knowledge of migration causes is immense, but political will to act is somehow in a short supply. Health worker mobility is not simply a problem in itself, but should rather be understood as an opportunity to even out the principles of free mobility with those of solidarity and of equal opportunity. Quick fixes interfere with long-term and evidence-informed policy making and investment in the health workforce. Commodification, commercialization, and privatization of public services interfere with the principle of solidarity and shared responsibility in support of equitable, sustainable health workforces. Health services are public goods according to the Constitution of WHO. They are constitutional public goods. Let's remember us. Gender power relations are replicated in health workforce migration. Today's discussions takes place 1 year since the World Health Organization declared the novel coronavirus outbreak a public health emergency of international concern, WHO's highest level of alert. Since last spring, health systems are struggling with provisions of essential health supplies and services. Doctors, nurses, the auxiliary health personnel are on the front line. They are heroes of our time. Expertise and self-sacrifice of medical professionals saved hundreds of thousands. We salute our heroes, but at the same time, we should recognize weaknesses of health systems exposed and challenges created by the pandemic. Insufficient numbers of medical personnel in many national health systems are hampering provisions of life-saving services. In some countries, the smooth vaccination appears to be under threat because of shortages of workforce and especially nurses. Pandemic will bring changes and we should invest in understanding of these new developments. At the same time, a fundamental question, how to strike a balance between objectives Europeans are looking for will remain. The free movement of people is a cornerstone of an open and integrated Europe, but free movement should not undermine the understanding of the following. Immigration of highly educated workers places strain on countries of origin. This hampers the ability of sending states to deliver on the human right to health, while fueling nationalistic sentiments and eroding a vision of European solidarity. Big questions require greater expertise. Some of the best European experts will help us today to understand the complexity of health workforce mobility in Europe. I hope the discussion will bring us closer to understanding what local, national, pan-European and international policies are needed for proper development of human capital in the health sector, for the health and well-being of all our people, to speedy finding solutions that would benefit both donor and recipient countries. Let me remind you, health for all. A very important principle and slogan, health for all. COVID-19 caused suffering, but at the same time triggered opening of a new chapter of European health policy. Until recently, health-related matters were considered by the EU almost exclusively as business of the member states or quasi-markets. With COVID-19, there is a realization that the EU needs to be stronger in health. Manifesto for European Health Union, made public in November 2020, calls for responsibilities shared between the EU and member states in health, including, as I am quoting, recognizing the importance of health workforce, the European Union and the member states will work together to address the unequal distribution of the health workforce capacities in Europe, providing support to regions that have difficulties in attracting health workers, as well as promoting training and education of health professionals to common standards, coupled with measures to safeguard the rights of health workers from the rest of the world. Current health-focused actions of the Commission, especially an initiative on European Health Union, and more articulated emphasis on health in the frame of the European Pillar of Social Rights, corresponds to expectations of most of stakeholders in health in short-term perspective. The conference on the future of Europe, that should start in May this year, is a perfect platform to integrate stronger cooperation for health into mainstream European policies, to discuss the European Health Union as an initiative with potential to shape European politics for decades to come. And it is impossible to move forward without possibilities to find pan-European solutions addressing healthcare workforce shortages in the EU. Let us make today's webinar a step towards the European Health Union. Let us start our debate. Thank you, colleagues.